an element that I hear: passion and community. And we're here in the exhibit at the library here at Florida Gulf Coast University. And all these archival and special collection artifacts that are around us tell a common story: community, passion, and tenacity. So going back, I want to take a trip back in history. A couple of us mentioned that we've been here since we were 18 or born here or moved here at a very early age. Take me back a little bit during the time of racial segregation. Are there any memories that you all recall of growing up here, having connections here in the Lee County, Southwest Florida community during the era of segregation, or perhaps from your childhood? Anybody, anything you want to share?
Well, I grew during the time that we were in school, for an example. I graduated from Dunbar in 1964. We lived our own world, in our own world. We didn't think about what was across the track. We know that we had the leftovers, the band suits and the books and all, but it was okay. We accepted it, and we enjoyed our life. I think we in Lubbock can tell you, we had a good childhood. We were happy because we didn't know we were poor because we were all on the same level. So I didn't find that out until I started paying bills and was grown. I found out that I was poor, but you just didn't know you had, because we had certain things that we look forward to. I think about when I was a little girl. Every Wednesday we knew we were going to get cookies, and we knew my daddy, he got paid off on a Wednesday, and we knew that he was going to be walking down that road and he was going to have a bag and it was cookies for us. So there's things like that that was very special in our childhood, even though we know there were other things
Yes, ma'am.
that we were not privileged to.
True. I can say, growing up here, it definitely was a segregated place, because in Dunbar, it was really unusual to see a white person. Usually if you saw a white person, it was an insurance man or it was the police. And I'm a little younger than many there, because I can recall walking around, and if you went downtown, you had to be on your best behavior. And there were a couple of places downtown was First Street. There was nothing else around. Most Anderson Avenue was a 2-lane road, and most of the roads in Dunbar were dirt roads. And I could literally stand in my father's backyard and see my grandmother's home on Thomas Street from Lafayette Street, because our home was like the second or third home on the street. But you knew something changed really as we got into the late 60s, because I went to Dunbar, I believe, in 65, and it was a 7th through 12th grade institution. And it was a new school. And when mandatory integration hit in, I believe it was after 69, they took all of the black students, which was really my senior year, and split them up between Fort Myers, Cypress Lake, and North Fort Myers. And that was tumultuous years. I was glad I only had 1 year of that, because I can recall at Fort Myers Senior High School, we had a Black History program, and at North Fort Myers and at Cypress, they had come down with an edict that they could not have their programs. So the blacks actually left those schools and came to Fort Myers. And we put on a program, but it was not without some turmoil. You knew when it was time to go home for a vacation, because somebody was going to fight.
Okay.
Okay, and I was an athlete back then, so I can vividly recall one time we had a fight at school where before it jumped off, all the athletes were cordoned off into the gym. And it really didn't dawn on me until later on why they wanted to put us in the gym, because obviously if you were an athlete, you might hurt somebody. Even though you might not be mean-spirited, but you were in better shape than everybody else. And so it was kind of wild. They went through that probably in this area about, I'd say 5 or 6 years, because when I went off to college and came back, things were kind of calmed down, but you still had that kind of up and down type of relationship between blacks and whites. And primarily because I tell people a lot of times, really, you start talking about 1968 through 70, people were pretty straightforward about what they felt. I mean, whites had strange stereotypical things about blacks. Blacks had, and it was just like putting hot and cold together. Whenever you put hot and cold together, my dad was a science teacher. You're gonna get a storm. And we had that. But in the neighborhood, to grow up in a segregated Dunbar was wonderful. I mean, we had our own businesses, we had our own shops. You really didn't have to go to town for anything, because I remember the B&B on Anderson Avenue. You had your own grocery store, movie theater. And while it might not have been on par with other places, there weren't that many other places because there weren't that many people in Lee County. We'll get into my grandmother later on, but it was, we went through a transition. We did.
So thank you for sharing that. And we'll come to Ms. Ware, but I want to give a plug to our previous panel. It talked about a lot of the things that Mr. Wells talked about, the integrating of the schools here in Lee County. So for our viewers today, if you hadn't had a chance to go back in the archives here at the Bradshaw Library and see the panel that we did about a month ago that talked about the integrating of the schools here in Lee County. Ms. Ware, did you want to add something?
I want to take you back. I'm a little older than most of the panelists here, so my mother was born here in Fort Myers, and my grandfather, I do believe, probably was too. However, I want to take you back to the 60s, the middle portion of the 60s, when that was the civil rights movement. And when I journeyed to Tallahassee to attend Florida A&M University, I came from a predominantly all-black school, which all of these were sitting around this table. So also I went to an all-black college. What I remember leaving Fort Myers on that trailway bus from downtown, remember when we crossed over Evans Avenue, that's a different world. To the east of Evans was Dunbar. That was our world, and as many alluded to the fact that we were very happy people because we didn't have sense of know we were poor. My mother had an outside toilet, so we thought that was par for the course. So anyway, when I left to go to Florida A&M, and I boarded that trailway bus to go, downtown there was the water fountains that clearly stated colored and white. And I can visualize that just as plain as day in my mind. So when I would go off to A&M and come back, and we got to that trailway bus station, if you were hungry, you didn't go into the front part. You went to the back and you got your sandwich from back. They had the best hamburgers in the world, but you weren't going into the front part to get it. So when I returned in 1965, there was still segregated schools. So that's why I can say that, as many said before, there was a hand-me-down books, there was a hand-me-down everything, but we did what we call making lemonade out of the lemons, and that's what we do. And that's what we did in the 60s. We had to fight. The era that I came up in was the era of fighting to get equal rights and to move out of the segregated schools that you are alluding to. And I was a part of that transition. So that's what I remember from back in the 60s. As Lovey can say, we had the Gary's Barbecue. We had the beauty shops. We had the movie theater that I worked at. We had the B&B grocery store. And then we had the little sundry. So we had everything we thought we needed, and we didn't know any better. So segregation to us was okay until we began to fight for betterment. That's civil rights. That's the era that you're getting ready to transition into.
Yes,
When
ma'am.
you leave the segregated world and come into integration.
Yes, ma'am. Thank you, Ms. Ware. Anybody else want to add anything?
Yeah,
Ms.
I
Ms. Blackshear?
would, because there was also some, I think, problems in that when they segregated, I think a lot of the black kids thought that they lost something. The teachers at the black schools really took you under their, wings and went the extra mile. And when they went segregated, and when my nephew was in that group, and he felt like they just, here it is, you get it or you don't get it, and I'm gonna give you this F, you know. So if you were having any problems with your lessons or studies, or they didn't seem to, where the black teachers would, come here, Johnny, you seem to didn't get this. What can I hear? I know his dad, I think, one of that, and they really went the extra mile.
Yes, ma'am.
So they felt, I never went to a white school, so it was, but my nephew did, and he was played on the football team. And he went to North Fort Myers, and he said when they would walk home from practice, because they would stay after
Yes,
school,
ma'am.
and the whole way home across that Edison Bridge, the white guys would throw bottles and cans and stuff at them, and they would have to run from North Fort Myers across the railroad track to get home. So there was, you were made to feel different in many instances, because, and I think they could see a big difference in the teachers. And I'm not saying all the teachers were
Yes,
that
ma'am.
way, but I think there were enough that made them feel that way, that they felt very uncomfortable with it. And he said he could see the difference in
That's
it
cool.
immediately when he left Dunbar and went to Norfolk High.
I
You
know we're
have to
talking, I'm sorry, Diane, go ahead.
Mm-mm. You had to be very strong when you went to an integrated school. I went to an all-black school, and being a dropout and have to struggle to pull my life back together and decide that I'm gonna go to college and go out to Edison, and we ran a I'll never forget this. Had to write a comparison paper, and the instructor says, yeah, for example, a white man's brain is bigger than a black man's brain. I'm sitting in that class, only black. I was embarrassed, but determined. That's why I applaud anybody who go and get their degree, because I know it was not easy. It was not just the studying, but it was a struggle when another man didn't want you to have that.
As the newcomer in the community, my wife and I came here in 1975. And one of our early observations was that this was quietly segregated. Because we came from Cincinnati where it wasn't quietly segregated. And then secondly, it wasn't too many years after that, I remember that the two of us, my wife and I, sat with a number of nurses and longtime Lee Memorial Blacks at that point, so long time, a few years. But they shared the story that ties into what you all are describing. At the time of integration, who was bused? It was the blacks that got bused, the whites weren't. So the blacks, as soon as school was out, unless you were an athlete or you were playing in the band or something, you left immediately. So you didn't really have any real interaction. And you lost the leadership opportunities that you had in your schools, and now suddenly you weren't the leaders. And it took many, many years before the blacks became leaders in the local schools. But it does have an impact on so many other things in the culture of this community, which will tie into healthcare.
That's a great segue. So I want to go back to you, Mr. Wells. We talked about community and the community connections. Something that was a tradition passed down in Black communities and Indigenous communities was the concept of midwifery, being a midwife. And I understand that your grandmother was a second generation midwife. So can you tell us what a midwife was and what that was about in the community, and a little bit of information about your grandmother?
The midwife was the doctor in the Black community. My grandmother, which we called her affectionately Big Mama, was second generation midwife. She should have been a doctor, to be honest with you. She had her own hospital. She delivered myself and all of the boys in the family. The only reason she didn't deliver the girls, because my dad was stationed in the Army in Texas. But she delivered over 5,000 babies here. And she was a workaholic. I mean, I remember Big Mama getting up all time of night, taking care of people. She had like about 6 or 8 beds in her home. And during those days, when you delivered a child, it was a big deal because they had rules like don't let the child come out for 5 days or something like this. Because if the sunlight hit them, it might do something bad to them, all kind of
Were they
wild
old
stuff.
wives' tales?
Yeah.
Old wives' tales. But she had patients all over Lee County. It wasn't just black patients.
Right.
She had white, she had Hispanics. And as a child, every now and then, we would accompany her on her rounds, and we would go in all parts of this county, and Big Mama would go in there and she'd say, well, how's so-and-so doing, and this and that, and she'd check the babies out to make sure they didn't have fever. And I used to joke with people. I said, if my grandmother got paid for every delivery, I wouldn't have to work. And if people would actually show up at her place there at Thomas and Prince, not having any real prenatal care and ready to deliver, and she would help them. She was a Seventh-day Adventist. She was a member of the Dorcas Society, which meant that she collected clothing from people, and if you needed clothing, she'd provide that. She ran a daycare center. I mean, all I can remember is that she never rested. I mean, she just worked, and that's one reason she should have took it easy, really, because she did. And she had my dad and my aunt, and they both my dad was a first generation college graduate, primarily because my grandmother felt that education was the key to a better life. Because before she became a midwife, story said she actually was a cook at a restaurant called a Blue Cafe or something. And she actually hauled pulpwood.
Really?
Yeah, back in the day, they were tough. My grandma, she had chickens. She had, this place now is nothing like it was then. This was a sleepy fishing town that people stopped in from going from Tampa to Miami. This was a little stopover here. But as far as my grandmother was concerned, she had friends everywhere. I mean, when a person was delivered, she had to do the birth certificates. She had a relationship with the local doctor here that if there was any problem and Miss Mayola brought them, they immediately handled it. There was no questions about who are you, what, no. She was
She
the
was
person.
very well respected.
Very well
Very
respected. And
Mhm.
I mean, that's where I think my family gets its work ethic.
Work ethic from your grandmother.
Yeah, because I mean, that's just the way she was. And we only found out later on that her mother did the same thing in Punta Gorda in the 1860s. So Coralie Ponder, her mural used to be on a building in Punta Gorda until Charlie came through and ruined it. But Miss Mayola was a workaholic. And when I talk to people around Lee County, and you talk long enough, you find out that either their dad or their dad's dad was brought here by Miss Mayola. But she was my grandmother.
Right.
And everybody's like to claim her as a grandmother.
She was your
She was
grandmother.
definitely my grandmother.
So you raised an interesting question here. Was anyone actually delivered by Miss Mayola? Miss Jackson, that's what I was anticipating. So, You had that
Yeah.
family connection. You have any thoughts? You said she was well respected. Do you recall Miss Mayola and the
Oh,
role she played?
I recall her because she delivered, 6 of my siblings.
Okay.
And I never forget, and I don't know if Cleve can hear this, but it was so funny when she brought my mom home and my brother Charles was born, and she had this black case that she would always carry. You couldn't convince us that that baby didn't come out of this suitcase. Say, all of a sudden, Mama left home and she came back, and Miss Mayola brought her back home, and all we saw was the black case and then a baby.
That's
It wasn't a stork, it was a race.
right. For all of us who are viewing us tonight, we encourage you to still come out and check out the exhibit here at FGCU. There's actually a special section about Miss Mayola, some of the birth certificates that Mr. Wells mentioned, as well as her original baby scale. So we encourage you to still come out while the exhibit is still
Jarrett,
here.
while we're talking about midwifery, I wonder if Flora can share with us some of the memories that she has as
Her
the
grandma.
struggles of midwives trying to
Right.
get hospital
That's right.
privileges and.
Oh, yeah. It was kind of a tough thing. And I was talking to somebody today about it, and we had this situation where I had some doctors who didn't want the midwives, and I had a couple who wanted the midwives. And we were talking about Dr. Howington, is how it came up. And in that, he was the one who became kind of my mentor in this whole
Yes,
thing.
ma'am.
Now, he wasn't really for midwives at first, but one of the things that he did when he was head of the department, he invited me to their department meetings.
Okay.
And because I think I went to Jim and talked to him, I said I felt castrated most of the time. They'd go to this meeting and they
Call
would,
Olivia and tell her,
and they would come back and they tell me all the stuff that I needed to do. And they would only have half the information. So he invited me to the department meeting so that when they bring up a subject, that I
You're able
could
to be-
answer that right then.
Yes, ma'am.
And one of the subjects they would bring up was about the midwives. There was a lot of issues that the doctors had about delivering babies of indigent patients.
Yes, ma'am.
And that was a problem because they felt like they were not getting paid for that. And a lot of the discussion was, well, they come in here with this gold and these gold teeth and this, these designer dresses, and they can't pay me. And I was telling somebody the other day, and one of the doctors say, Flora, I can't take no chickens and oranges home to my wife. She's got to pay her bills too, and I have to run an office. And with all the input that I was getting from the doctor, we had many, many discussions about the pros and cons of midwives, and
Yes, ma'am.
and I did a lot of calling, and I'd go back to the department, and finally, Dr. Howington and I got together, and he said, Flora, we either people either got to shut up or they got to put out. So meaning they had to decide to do midwives or not, because the issue was that they had to come in and deliver these babies, and a lot of time it took away from the office.
Yes, ma'am.
So, and I have to give credit to Sister Bernice, who was at the health department at the time. And she, I tapped into her, and she said, Flora, this would be the best thing that could happen is that for the continuum of care,
Yes, ma'am.
that they would go to the health department and get care, and then they could be delivered by a midwife, because they do delivery and labor a little bit different than the doctors do. The doctors come in just before you deliver, and where the midwife stays through the labor period and through the delivery. So I had to call around the United States and talk to midwifery services, how they were implemented, what are some of the pros and cons, and what some, things that I guess the doctors fought again, and they were proved to be, really not a problem. So with much to do, Dr. Howington took away from his practice. He and I went to Tallahassee, St. Pete, Miami, and we fought to get monies the state to give us monies, to start up the program to pay the midwives
Okay.
to deliver the babies.
And did I hear you say your grandmother was a midwife?
Yeah, my great aunt was a
Great-aunt, yes,
midwife.
ma'am.
Yeah,
Okay.
and her mother was a midwife. And I used to go around with her and sit on the step while she would deliver the baby. They wouldn't let me in the house. I could only bring a hot towel to.
So a hot towel and a bag, so all these are things that the
But,
tools of the
but the
trade.
midwifery program, once we put it in, and what was really interesting about the program, once we got it approved, after about a year, I think, so back and forth, maybe longer than that, we had it for the indigent patients, and they heard so much about it. Then I had women storming my office, the private patients. They want, why we can't be delivered by a midwife? And so the doctors then started to hire some of our midwives. It's like, a side job kind of thing, to deliver their patients, and then they finally hired a midwives for their offices.
So that's a rich history. So I want to come back to that part. And thank you, Ms. Blackshear, for telling that. I just love to hear you talk. You share a great story. So we have a little something inside the envelope. So there are two things that I want y'all to take out for me. Two pictures here. And that's going to be a segue to the next part of our conversation. I paper clipped them for you. Anybody tell me, or anybody know, recognize those pictures that we have in front of us? Ms. Ware, those pictures look familiar to you? I see you laughing over here.
Miss Mills' house.
So I'll give you a hint with this one. Jones Walker Hospital. So Jones Walker Hospital was dedicated in 1924 to serve the Black community here in Lee County. And it was under the efforts of Miss Melissa Jones and Miss Candace Walker. And they raised money by selling pies at church events and community events and school events. And eventually a new Jones Walker was built in the 1940s. So what you have in front of you is actually the artist rendering of the Jones Walker that was built in 1948, opened. And then on the back, there's a picture. So Nathan, you hold that one up. I think some of our participants, the second one there, can see that one. So for those who can't join us here in person, that's actually a picture from the grand opening of the Jones Walker Hospital in the 1940s. Did anybody work at Jones Walker?
I did.
You worked at Jones Walker Hospital. So Ms. Ware, tell us a little bit about Jones Walker Hospital and the role that it played and how you were connected with the hospital.
Okay, in 1965, I returned to Fort Myers with a degree in nursing, a BS degree in nursing, and I attempted to apply at Lee Memorial Hospital, but I was refused to be hired there. But instead, I was hired at Jones Walker Hospital, along with Doris Goldman, who was the first Black RN here in Lee County, and Jody Kinsey was our supervisor. I worked the 3 to 11 shift, and Doris worked 7 to 3. And I remember vividly of only having one LPN that was Minnie Scurry, and Cleve Henry was one of the orderlies that worked there with us. And we had to take care of anything and everything that came into that hospital. We called the doctor and said that the woman was so many centimeters dilated, meaning that you need to come on if you're gonna come, because the baby's not gonna wait on you. So what would happen oftentimes is if the doctor didn't get there, Doris and I had to deliver the babies. Whatever came through that hospital, if it was a gunshot, it was somebody cut, whatever came through that, the Jones Walker was everything that a Black person could have as far as medical care was concerned. So whenever they had to have surgery, they were taken to Lee Memorial Hospital and they were operated on and immediately brought back to us at Jones Walker. So whatever came to us, we had to survive and take care of it and make sure that they survived. I remember vividly a young man that had a tumor on his spine that was supposed to never walk again. But I do say that with pride that Doris and all of the nurses' aides and all of those people that assisted us, the Pearl Wileys, I can go, name so many of them, Becky. We took care of that young man, and today, he walked when they said he wouldn't. He played sports when they said that he wouldn't. I remember one other person that was hit by the train crossing the railroad track, and that was Barbara's father. Minnie, that was Barbara's father. He was hit by the train, and he was brought to Jones Walker, and he was all in traction. We took care of anything and everything that came to us at Jones Walker, but we never whined or cried, but we were adamant with our passion. And Doris would say to me whenever I had a hot temper at that time, and I would tell him in a minute, if I didn't take anything then, I'm sure not gonna take anything now, I got a degree. And she would say, no, Jerry, you gotta stay. The people in the community need you, and that was all she would have to say. And we would support each other, you know, whenever we would get down and feel like this is awful, they would motivate us to keep on persevering and take care of whomever they brought to that hospital.
So I got a question for you, Ms. Ray. I'm gonna
Yes.
put you on the spot, since we're
Sure.
talking about Jones Walker.
Yeah.
So this is the preliminary rendering of what Jones Walker
I
looked like.
remember the.
So this is, we can all pass it around if you want to look at the
Yeah.
architectural rendering of it. So imagine it's 1965, Ms.
Yeah,
Ware.
sure.
Can you walk us through what a typical night would have been for you serving as a nurse at the All Black Hospital?
Okay. Coming in before 3 o'clock, that was a changing of the shift.
Okay.
Doris would be there, and Doris would sit down with me, and at that time, we would always nurses would give each other reports. First of all, I want to say this with pride. We had to walk in there with our white uniforms, our white hose, our white shoes, and our white hats on our heads. That's the way we had to look, immaculate. So when I would enter that door, Doris would say, if she wasn't too busy, Jerry, hold on a minute, I'm coming, I gotta finish this, I gotta finish that. And we would sit down and get report. And I remember walking in to the left, that was what we would call the emergency room area. I can see it just as plain as I'm sorry.
It's okay.
Oh,
It's real.
right.
So Doris would come and give me report. I would then take Winnie Scurry and people like Cleve Henry and say to them, this is what we've got to take care of. It didn't matter whether it was a surgical patient, medical, whatever it was, that's what we had to do. So in the course of a night, like I would say, Cleveland knows would make sure kept walking around to make sure everybody was okay. And if he would come out and say, Miss Winnie Scurry, Miss So-and-so needs pain medication, where it would go. If there was a situation that she could not deal with, she would come and say, Jerry, so-and-so and so is the case, so-and-so is the case. If it was anything dire, I would have to then call Jody Kinsey and say, look, we got a crisis. And I cannot resolve it.
That was Whitley Memorial?
Yes,
Okay.
So then she would come and help to resolve whatever it was, but if it was something that we had to resolve, we had to do it. It doesn't matter what it was, we had to do it. And so that's what a night at Jones Walker was like. You are ready for whatever came through that door. And like I said, I can see Maretha Griffin preparing the surgical instruments. All of this stuff is just as vivid in my mind, and seeing Barbara's dad in traction and seeing Sharon's little brother, Tony, with that cast on his body, full body cast because of the tumor on his spine. So that's why I can remember Jones Walk, is because, like I said, we were blessed. God just was looking over us. That's all I can say, because he helped us to persevere. We didn't whine, we didn't cry. We just did the best that we knew how to do and prayed a lot. Now that we did, 'cause that's the only way you could survive that back in that day.
So, Ms. Ware, you mentioned Mr. Cleve Henry. I believe Dr. Henry has joined us today, and I don't know if he's able to take himself off mute, if he can hear us. Dr. Henry, are you with us?
Can you hear me?
Yes, sir. How are you, Dr. Henry? So I understand you were an orderly. Ms. Ware just gave you a nice little introduction here while you were a
Yes,
student. Can you tell us any memories or recollections you have from your time as an orderly at Jones Walker Hospital?
yes. And I enjoyed her comments. Uh, I started working at Jones in 1960, at Jones Walker in 1960. And I worked there. And I also, well, before I came over to Jones Walker, I'd worked in the kitchen at Lee Memorial. And then I went over to work there at Jones Walker. And there were only two ladies in the kitchen. All of the food was cooked at Lee Memorial, except breakfast. And then they brought it over to Jones Walker. And those two ladies served all of the patients that were there. Now, one of the things that I can remember so well is that we didn't have emergency EMTs at that time. The patients were brought to the hospital by the ambulance from the funeral home. And of course, that did take up a little bit of time, because we had a case where people came over sometimes, and we had to take them over to Lee Memorial in order to get them x-rayed and then perform surgery, and then brought them back for patient care at Jones Walker. And we did it. We did it. We did what we had to do. And we had one lab technician, her name was Jarrett. And and as I heard Jarrett talked about the emergency room, there were times that people would come in and you would go to the left to the emergency room, and you had to wait until a doctor would come over sometime and give you instructions on which ones should be taken to Lee Memorial to be x-rayed, and which ones that could be, the situation could be taken care of right there at Jones at times. Right. So basically, after Jones closed, of course, then we moved over to Lee Memorial. Right. And I hope you still can hear me. My computer is doing strange things. Can you hear me? Can you hear me?
Yes, sir, we can.
Oh, okay. All right.
Sure.
I was kind of worried about that.
Oh, you're loud and clear.
And she named quite a few of the nurses that were there at that time. Yeah. And some of you may know Raphael Newton. He's in Orlando now, but he also worked as an orderly there. Then he went to the police department. Yes.
Well, thank you, Dr. Henry, for joining us. Dr. Henry is a doctor of education. He's also the brother of one of our panelists here, Miss Minnie Jackson, and very good friends of my personal family, the Eady family. So we're very happy that you were able to join us, Dr. Henry, and offering those perspectives. And it's something that Dr. Henry mentioned, and I think I would like for us to go back and look at. Inside your envelope, courtesy of the Lee County Black History Society, there are two additional documents. So Ms. Ware, you talked about the discharge. When individuals were sent to Lee Memorial.
Right.
If you're ever interested in seeing additional information about the hospital, those are the discharge instructions of when Black patients were admitted to Lee Memorial. So anybody would be interested in reading that for our attendees tonight, if they can't see it, would someone like to read that top page so we know?
Gladly.
Ms. Ware, go ahead, I'll give you the honors.
Regarding the admission of JW patients, which is Jones Walker, Negro, in parentheses, as inpatients of Lee Memorial Hospital. If questioned by a news reporter, do you have a Negro patient admitted in Lee Memorial Hospital? Answer, yes. Immediately follow up with, because of the severity of the patient's illness, it was decided by the officials to admit here. Do not give out any further information except patient's name and address. Do not give doctors' names or any JW Negro patient admissions to Lee Memorial Hospital. No publicity to be marked on chart, ledger, and visiting cards. Admission to private room. Admission to semi-empty and hold. Admission to hall. Hold 12 hours. Hold 124 and 125 for this purpose, if at all possible.
All possible. So tell us what else is it saying? So this takes you back to what you were telling
It
us
sure
earlier.
does. It's so vivid, I can walk those halls today. Number one, when colored patients are in recovery room following surgery, recover as usual until the recovery room nurse feels the patient is ready for Jones Walker. Number two, recovery room nurse will call the shift supervisor to notify her that the patient is apparently ready for transfer, reporting general condition, blood pressure, pulse, awareness, etc. The shift supervisor will call the attending doctor to report the patient's condition and consult with the doctor about the transfer to Jones Walker via ambulance. The shift supervisor will record the conversation and note on chart the doctor's order regarding transfer. Request that Jones Walker send someone with the patient to accompany the patient. I repeat that. Request that Jones Walker send someone with the ambulance to accompany the patient. Recording. Notes of conversation as far as possible to be recorded as accurately as possible on emergency room sheet or recovery room record, a supplementary nurse's notes.
Does that feel familiar to you?
Just as plain as day.
So that was a memo provided to the staff of Lee Memorial that corroborates Ms. Ware and Dr. Henry's comment of when individuals from Jones Walker were admitted to Lee. And Mr. Nathan, I want to go over to you. I know you had some context about how the surgical instruments may have been used. And in fact, here at the exhibit at FGCU, courtesy of the Lee County Black History Society, there is the old Jones Walker surgery box because the instruments from Jones Walker for the patients were kept separately. So you want to add anything?
I'd like
and
to
take from
add,
there?
I got a call this past week from Dr. Roger Scott. Roger, for those who are not aware, was a longtime phenomenal surgeon, highly well-respected white surgeon, and but came in the community in the late 1950s. And he took all the as much emergency room call as he could possibly take. And if you were on call at Lee Memorial Hospital, then you were also on call at Jones Walker. So when taking that call, if there was an incident, an emergency at Jones Walker, he would go there, he'd evaluate the patient. But if the patient needed surgery and was not to be transferred to Lee for that short-term surgery, for that procedure, then he would call Lee Memorial and tell what instruments he needed, and then he would drive in his own car over and he would pick up an operating room nurse and a nurse anesthetist, and they would accompany him, and he would bring the instruments. And I hadn't seen this box before, but he described in a wicker basket, and very descriptive about the wicker basket to come over and do the surgery. One story that I'd like to add to this is that to the way it's been reported to me is that there was one Black actually admitted to Lee Memorial who was not transferred to Jones Walker in the mid-1950s. And that was a man that was down in the Bonita Estero area and had gotten burned, burning up shrubbery, and was burned badly. And someone, a passerby, found him, took him to Lee Memorial Hospital. And a brand new orthopedic surgeon who had just come to town, Dr. Jack Warnock, went to the relatively new CEO at that time, John Gadd, and said, this man won't survive if we try to transfer him. So they shook hands and agreed to admit him. And the story, as I understand it, was almost immediately the word got out into the white community, and they came and pulled their loved ones out of the hospital because of this man. But it's my understanding that he survived, and that's some of the people in the community knew him for many, many years. But until this integration occurred in the 60s, it did not happen. This was the only one that was actually admitted and spent time there.
So thank you for that context and the great segue to the final part of our conversation. In the last few minutes, so Ms. Ware, you told us in 1965, you transitioned over to Jones Walker, and then the hospital eventually closes.
Yeah.
And I know you all have some context about the closing of the hospital, and why it was closed, and the lawsuit that was filed in 1965, closing around 66, 67. So Mr. Nathan, any context you all want to add to that next part of the story? Because I know your story with Lee Memorial starts to pick up not too long after that. But what were your thoughts about why you felt it closed and where we stand from there?
Well, we knew why it closed. Doris and I knew why it closed because Jody Kinsey came and gave us whatever they thought they wanted us to believe, but we were taught. And we accepted what was going on. And Doris and I, that's when we left and went over to public health nursing. That's when we were hired to work for the county, to work as public health nurses from Jones Walker. That was how we transitioned. We never did go over to work at, we were not transferred over to Lee Memorial. Instead, we went to work as public health nurses for the county as opposed to going to work at Lee Memorial.
So,
And Doris
Yes,
did
ma'am.
work at Lee Memorial on West Wing
It's
with
gone.
Jody for
Okay.
a while.
now, when did you start, Ms. Blackshear?
In 65.
Okay, so now tell us your story.
Well, as I was talking earlier, that my dad worked for Dr. House and worked for Miss Lucy Nelson.
Yes,
He
ma'am.
did yards then as his side job. He worked for the city of Fort Myers as his regular job. But anyway, I came from Baltimore and I was only gonna be here for a little while. And then I was gonna go back, but then I decided, well, let me go around and see if I can find a job. And I went to Jones Walker and I went to the health department and blah, blah, blah. They said they didn't need anybody. And I was planning to go back to Baltimore at the time. And Miss Nelson, my dad told Miss Nelson about my thinking about leaving and going back to Baltimore. And she said, oh, no, we need nurses at Lee Memorial Hospital. So she and Dr. House, I guess, went to Mr. Gadd and Betty White, and they decided they would hire me. Now, it was interesting when I got hired. That's why I always kind of respected Clara. She was one of the nurses there. When I walked in, you could think I had dropped a bum in Gilead.
You were the first Black nurse.
You were the
Yes.
first Black nurse, right. And you said 1965.
Yeah.
And that was around the time when the lawsuit was filed,
Right,
right?
it was in
Okay.
December 65.
Yes, ma'am.
And when they gave me, the assignment they gave me was, fair and what have you. But some of the patients didn't want me to take care of them. So Miss Nelson took me under her arm and she would assign me certain patients and I would take care of them for a while. But then the patients who I took care of really liked my care that they gave and the doctors liked what I did. So I began to, gain a lot of respect from everybody. And before I knew it, they had transferred me over to pediatrics.
Yes, ma'am.
Because I had a lot of support from the doctors. And I can remember one day, we had this patient who had gotten broken neck. He dived off the bridge down at Fort Myers Beach, and Dr. Hilliard, who was our neurosurgeon, and he said he was coming in that morning and he didn't. So the family had been there like 2 days and trying to decide what to do, and the child decided, they went home. I told them to go home and get some rest, and just as soon as they left, we didn't have cell
No
phones
cell
then.
phone.
He came in and wanted to do surgery. And I never forget, Dr. Agnew was sitting at the desk, and he came in and he said, and I guess I was kind of a little maverick by then. And I said, you can't operate on this guy, because if he dies and the family's not here, I will never forgive myself. And he got a little bit, upset, but he waited. And Dr. Agnew stood up. He said, Florrie, you really are an advocate for that patient,
Yes, ma'am.
that you, and so I called a home down in Lehigh and they came back. But and I guess one of the things I liked about Lee Memorial while I was there, I never applied for a job. I always got my promotions by Jim and them calling me to the office and saying, would you like to do this, And I always felt good about that, and I think the doctors in many instances had a lot of support for me, and they really liked the care that I gave. And just in our 100th anniversary, Dr. Guttery said to me, he said, Flora, do you realize that you changed the practice of pediatric care in Lee County when you came to Fort Myers? And I said, well, how did that happen? He said, I was trained my nurses so that we could do the admission, and, I taught my nurses to do chest sounds, heart sounds, and they only let me do it, but I would, take them, get x-rays if they had respiratory stuff, and I'd call the doctor with all this. They never had to leave the office, where before, when they admitted a child, they would have to leave the office. So they saved a lot of time by my being able to start IVs on the kids and what have you. So it really made me feel good that he said that it had left something, with doing that, and
Well, you left a lot, Ms. Blackshear, as a child growing up in Friendship Baptist
Oh,
Church.
yeah.
Knowing the advocacy of you and Ms.
Yeah.
Doris Gallman
Yeah.
and Ms. Ware and Ms. Dot Newton, who I believe also worked at
Yeah.
the hospital. So we've established a timeline. Ms. Ware, you come back in 65.
Mhm.
You're at Jones Walker. The lawsuit is being filed.
Mhm.
65, Ms. Blackshear, you're here, and now
Mhm.
you're integrated in the hospital.
Mhm.
So I want to go over here, Ms. Jackson. Now, when did you start, if you don't mind sharing with us?
I started in 1973.
73, and then what?
So I was the second
Second, there we go.
Mhm.
black nurse that was
Okay.
hired by Lee Memorial. And I worked in mid-surg on
Okay.
5 North. And it was under Miss Bruce. Patients didn't receive it well, but it gave me courage, and it taught me, I learned a lot from Lee Memorial, because it was many doctors would not make rounds with me. The white nurses would make rounds, and then they would change the dressing and bring the kid in to me and say, okay, here, this was sweet from your patient. But I learned to say, then you clean it up. It took time for me to do that, but I learned how to persevere.
Yes, ma'am.
And it gave me a lot of courage. I had, Dr. Barrow was my support. When I worked on the urology floor, he taught me how to irrigate, how to put in a Foley and all of that. So if I could not put in a catheter, I was so good. If I could not put in a catheter, then they was taking them to surgery. Because I had gone to
So
be
good.
that good. And 2 years later, after being there, I was promoted to assistant head nurse. I was told right in my face by the head nurse that we didn't want her. We wanted, told the younger nurse who had just finished school, we wanted you. I wanted you. However, they picked many. I took it. I said, that's okay. I took it because I know I was qualified. I was qualified for the job, and I did it, and I did it well. I would go home, for an example, I would go home at night, and if I had a patient admitted before I left the hospital, I wrote down the diagnosis, and then I came home and I studied that night so I could be prepared for any questions that was asked of me of my patients. And the families would pass by me. I would be at the nurse's station. I patiently sat there because I knew you had to come back because I was the only nurse there. And they would go to the white aide. At that time, they were called nurses' aide. And the nurses' aide would say, you need to go talk to the nurse. And then I would answer. So it was tough, but it was good. It was learning. I learned a lot at Lee Memorial. It brought me from a girl to a woman,
Yes, ma'am.
and a strong.
It's that tenacity.
Yes, and then later I worked in recovery room. I was really the first one that went, the first RN that went behind those double doors. I was well received by the surgeons, and even some of the doctors would tell me many they came to you and asked me if you were qualified. So I think Flora and I probably were the only ones that was approved by doctors for the positions that we held, But one doctor told me, he said, I told him you'll be a fool if you didn't have it. She's the best thing you got here. And I worked hard for it, and I was very proud of it. And then for me, followed by Miss Diane.
So tell us your story, Miss
Yes,
Spears.
my story, I'm gonna make it short. When, again, I experienced the same thing many experienced, Flora, Jerry, doctors not want to talk to you. But I found that, we had the new building, but what I found is that they always, no, I didn't have a floor, I didn't have a home. They would put me over in the Jewett Cox area, and I'm like, this area doesn't have a good reputation for taking care, giving good care. And so, to escape having a bad reputation, to escape saying I'm a bad nurse, I went to work in the psychiatric unit.
Yes, ma'am. What year did you start, Miss Spears?
I became a nurse in 74.
74.
But I had worked as a nurse's aide prior to that.
Yes, ma'am, okay.
And so being in psych, and then I realized, you know what? I did not go to school for this. I went to school to take care of patient, to heal patient, the body, the physical piece of it. And when I came out, we opened up the first oncology unit in Lee County. Mary Carton, she was there for about 6 months, and then she moved on, and she said, you're gonna be the head nurse of this floor. So the first oncology unit in Lee County, I headed that unit up for many years.
Wow.
I felt very proud because I took it where it needed to go.
Yes, ma'am.
I gave it a very strong foundation in Lee County. But with that, I found out I had too many African-American men dying. I'm looking at the statistic. I said, okay, I didn't go just to take them to die. Something's wrong. And I knew that I needed to be outside of that building, in my community,
Yes, ma'am.
providing early detection to my community and education. And that was the start of me being able to provide health fairs and the support of the hospital and to save life. Breast cancer was my focus, prostate cancer.
Yes, ma'am.
So
That's that advocacy. And
that's
so, look, we talk about the civil rights movement. We started focusing on education and integrating schools. And when we think about civil rights, we think about laws, we think about policy, public accommodation. But as equally as important is justice in healthcare and the advocacy and the social justice connected to healthcare.
Yeah, I have two things I would share. We had a physician at the hospital, a couple of them, but he would come in and say, give a jug and pull a plug. I think you all know who that is. And one day he did that similar to me. He would he told the ward clerk, who was a white ward clerk, he would never talk to me. He'd
Now, what's the
always-
ward clerk, Ms. Blackshear? Help us out. A layman, so what's the ward clerk?
Secretary.
Secretary, okay,
Yeah, on the floor.
okay.
And so he told the ward clerk that day, because Miss Bruce wasn't there, so I was the assistant at the time. And so she came up to me and said, Miss Floyd, he wants you to pull the plug and give her a jug. And I said, you know, you can't take orders from a doctor. She said, yeah. And I said, well, I can't take orders from you. So you need to call him back and tell him that he has to talk to the RN about that order. She called him, and I have to applaud, and that was Dr. Selden. I have to applaud him. He came back just as she said. He talked to me. He gave me a name. I can't remember now. Everybody had their little name, Dr. Selden. And from that day on, he'd always come and find me. No matter, I don't care if I was down the hall, 15 rooms down, he would find me and give me the orders. And I you know, there was a problem, he solved it, and he didn't have a problem with it. And I had another doctor who walked up on the pediatric floor one day, and I guess the nurse's station was empty. And he said, Flora, he said, how did you become to manage all these white people? And I go, what? He said, you seem to do a good job. He said, I'm not complaining. He said, but it's very unusual to have a black person managing all these white people.
This was at Lima Memorial.
Yeah, uh-huh.
Wow.
Yeah. Jared, if I can key off of something that Diane, and take it back to Diane and Minnie, and then this outreach into the community. There was a day I hadn't been CEO for too long, and a few years, and we were trying to do some things to change the culture within the organization. And they came to me along with a gentleman, Jose Cesar, who was the head of radiology. And the three of them sat down and they said to me, you know, we're happy with the direction that the organization is going, but when we go home, we don't feel that our neighbors and our friends understand what we're trying to do. You know, help us make a difference in the community. And I remember looking to them and I said, I can't do that by myself. And it's not a light switch. But together we can make a difference. And you know, it's been really neat. And the kinds of things that Diane has done out in the community and the health fairs and all of you have been involved in have made such a difference. And to go to those events, especially the fairs for the last number of years at Dunbar High, you can see people's lives being transformed at just that health fair, that are getting the answers to questions that they were fearful of asking or they didn't even know who to ask. And you could watch that day, just at that health fair, their lives were being transformed. And that was just so meaningful to see, and really led to the realization that it's not about the hospital, it's not about repair center medicine, it's about the people, it's about the community, and the difference that these talented people can make every day.
So,
Jarrett,
yes, ma'am.
may I interject?
Of course.
I want Diane to share a little something that we will be doing tomorrow.
Okay.
With advocacy, and it shows how medical expand across the horizons, because we will not only be doing healthcare there, but with that activity that you're encouraging, we'll be doing voter registration, while we're taking blood pressures, and
Right.
we'll be doing share a little
That
bit about
wraparound advocacy.
how we are trying to get out into the community, in the barber shops, the beauty shop, anywhere and everywhere that we can get to try to encourage our people to have a better perspective of taking care of their bodies. And not only that, to encourage our young people to think about other occupations in the health field. Health has so many job opportunities
Tremendous.
that is just beyond the scope of what I could share with you, Diane.
Okay, and I'm gonna go back. Jim Nathan, some years ago, before he left, went to Karen Krieger, I believe, and gave her all this information about the barbershop, health, barbershop wellness. When we got together to talk about it, then all of a sudden COVID comes and we can't get into the community. Now we're back in the community with Dr. Jim, the barbershop wellness, and we're at Utopia, where we're there, we're meeting the people. That's what we have to do. We're out there with the people, doing blood pressure. We're talking about, we've done some STD testing, HIV testing. We had a physical exercise, talking about nutrition. And
Yes.
Saturday, we're going to be there again. We're there once a month, the first Saturday of every month. And this time, we're going to also have Jerry, and the voter registration is going to be there.
At Utopia?
So we're, the voter.
At Utopia, you
Yeah,
said?
Utopia.
Okay.
And so we're taking little by little pieces of healthcare to make that a better community. And it's called the Barbershop Wellness. I need to give Lynn Carson, Karen Krieger, Kim, Ruby Henley's with us.
Yeah.
And that's the beauty of it. We're having to compete within the community to help with that program. We've trained people within the barbers
Okay.
and the beautician how to talk about blood pressure. When they have their customers in the seat, let's talk about the blood pressure issue. Let's talk about your blood sugar. It's awesome.
And our
It's
pharmacy,
so-
and then to
With
get a
Dr. McIntyre.
pharmacy, and then to
And
get
the
a pharmacy.
pharmacists
in our
and the
community.
doctors.
I mean, it's just,
And that's the legacy, Ms. Ware, of
Yes.
individuals like
That-
Dr. Shadrika McIntosh being
Yeah.
able to come back and provide that service like you mentioned, Ms. Beard.
I saw the connection.
yes.
As you talked about what you went through and what you went through and all that. And then I thought, I'm on your shoulders, guys. I'm standing there giving you the foundation there.
Well, the barbers used to pull the teeth and do the surgery, et cetera, and now they're gonna do all the health, health
But that's so
improvements.
true. You know, Mr. Frederick Morgan, Dunbar
Yeah.
Morgan would always say, you standing on the shoulders. And so that's what it shows. And so me watching the progression going down the line of knowing that the story and the individuals like Ms. Frazier and others that we talked about who have been a part,
Yeah,
and Ms.
Yes,
Mayola,
Mayola.
and
yeah.
now hearing the next generation, you know, it's so important that each one teach one and that the
That's
next
right.
generation add it. So thank you for sharing that, Ms.
And
Mayola.
I have to say this, I just would bother me. Willie Jackson,
Mhm.
many husband, you know what I'm gonna say.
Uh-oh.
He played a huge part in making that prostate screening work in our community.
That's what made the Psi Phi fraternity.
Yes,
ma'am.
yes. Mr. Jackson did so much to get that going. What I did, I couldn't get it going. I got it going, but not like it needed to be. Mr. Jackson, I will always credit him and Dr. Breton for making it what it is and what it is.
So that's the community part. And we
Yes.
started at the beginning of it, talking about the advocacy in the community and the legacy and the tenacity. Jim, I don't know if you want to take any questions, might have time for maybe one or two questions from
Sure.
our group that we have here. And so, Mr. Nathan, there's one question they have here. Looks like we covered a couple of them, but it said, Mr. Nathan, can you speak to the efforts of Lee Health to address the disparities in healthcare in the Black community?
Yeah, I think that there's so many things even happening today. The creation of what's called Lee Community Care, which was one of the first in the nation of a health system-based federally qualified health center to be able to spread and advance the care in underserved neighborhoods. And it was a dream for a long time. It took a lot of effort to be able to get that approved. But the opportunity now, there's been a major grant that's been received to do even more in the Black community, be able to expand those services and not just in the Black community, but in underserved communities. But the point of all this is that I think over the last 10 years or so, we've been able to get ourselves beyond that. We wait till somebody's sick and try to fix them up and send them back out. And there's things like we see patients with chronic respiratory problems, and they may be in and out of the hospital or in and out of the emergency room many times. But if you actually go to their home, they're living in squalor. And so it's not the repair center. We can keep doing that and they're going to go right back to it. But the question is, how can we energize the community to come together and bring community resources together to make that happen? And I'm so proud of being able to see so many different organizations and community partners coming together and realizing the health of the community is not the hospital. It is a key player,
Amen.
but it's not that. It's the community coming together and realizing that people have to take ownership at all different levels to be a healthier community.
So,
I might add
yes,
something
Mr.
to
Wells.
that, too. One area I was involved in with the Lee Memorial Hospital too was the partnership between them and family health centers. That was a key thing of bringing primary health care available to the minority community as well, because if you recall, when she's gone now, Larry Hammer was handling that, they were on the campus of the Dunbar Community School for many years in portables, providing primary care. But they began to have discussions with Lee Memorial and partnered with Lee Memorial to the point of being able to develop a much more modernized health center. And when I look around the community now and I see family health centers, I remember where they started.
Yeah.
And you look at where they are now.
So impressive.
It's very impressive, because that was a collaboration not only between health centers, but also with the federal government too, because they were part of a federal network which began to work because the local large person in the healthcare industry felt it necessary to begin to put some money and partnership with those providers to make that available.
Lovey, remember, Lily came out of the health department. That's where Lily came out of, because that's when Doris and I were working at the health department. And we started these clinics in the community, and that's where Lily got the idea of, and that's how family health centers emerged.
So I want to say, we're at our time. We're a few minutes over. So for our participants who are still with us on the Zoom, thank you so much. This has been a rich conversation just to sit and listen. I'm in the company of greatness. Some of you I know my whole life. And so I appreciate that. And to the point of what Ms. Spears, I think it's an appropriate way to wrap us up for the day. You stand on the shoulders. And as me and a different generation, Oprah Winfrey years ago had her Legends Ball or Legends Gala. And the poem that they had was "We Speak Your Name." So as my generation, the community speaks your name for advocacy, for what you've done for your grandmother who delivered all of my relatives from the 1930s up until the probably 1960s, for what you've done now and the perseverance. You know, on behalf of our community and our generation, and without regard to race, color, or creed, when I say across Lee County, we speak your name, but specifically for what you've done in the Black community to elevate and overcome and exemplify what we're trying to display here at Florida Gulf Coast University. So we encourage you all to please come out and catch the remaining weeks of this exhibit here at the Wilson Bradshaw Library. And so thank you to our friends, and we encourage you to give donations and support so that events like this and exhibits like this can continue. And if all hearts are satisfied, thank you all so much for joining us tonight. And thank you to our panelists, and everybody, enjoy the rest of your evening.
Thank you so much for the
Thank you.
opportunity.
Thank
It's
you.
great.
Yeah, awesome.
You know, I wanted to, just as an off thing,
We done.
I
I'm
think,
not sure.
is it all? Is it
Mr.
all?
Yet.
Is all?
I don't know yet.
May still be on, but that's all
But
right.
this will be okay, I think.
Yeah, whatever. Keep it going.
Mr. Bates,
But
you're going.
I